Imagine your heart working 24/7 but slowly losing its strength, not stopping but failing to keep it up. That condition is called heart failure. And today I'll break it down in simplest and most exam scoring way so you don't just understand it, you remember it. So what is heart failure? Heart failure is dysfunction of heart. Basically, it cannot fill properly or pump effectively. So it leads to lower cardiac output. So heart failure is inability of heart to maintain adequate cardiac output. We can say that. Now causes anything that weakens or damage the heart can cause heart failure. And here are some of them. Cardiomyopathy, coronary artery disease, myocardial infarction, hypertension, arrhythmiasis, congenital heart disease, endocarditis, alcohol or drug use. Heart damage is equals to heart failure. So simple, and don't overcomplicate it. It is simple and we will understand it very simply. Now left versus right heart failure. Now this is super important in examiner's favorite thing. So now we will start with left heart. So we can see here left sided heart failure fails to pump the blood out. It can't pump blood out of the heart, so the blood backs up into lungs. So it and the symptoms will be like breathlessness, pulmonary edema, like that. And you can remember it in the way L for lungs means when left sided heart cannot pump the blood, it backs up into the lungs. Whereas when we see the right side of heart can't pump received blood to the lungs, means right side of heart can't pump received blood to the lungs, so the blood backups into the body, means the blood stays into the body itself. So here we can see that symptoms like swelling, edema, JVD, ascites we can see here, and this you can remember with R for rest of the body. Yes. So what happens in right side is right side fails to send blood to lungs, so the blood backups into the body, whereas left side it fails to pump blood out and the blood backs up into the lungs itself. So left for lungs you can remember, and R for rest of the body you can remember. Okay. Now diagnostics we will be talking about. So when we talk about diagnostics, let's talk about how we confirm the heart failure. So there is a test named BNP blood test. It is very important and it is released when ventricles are stretched. It is realized by ventricles from the excessive pressure and when they become stretched. And the values that you should remember is these. Then there is a stress test. Then chest x-ray that show that infertility and cardiomegaly. Then there is cardiac cath, and there is echocardiogram which measures ejection fraction, amount of blood being ejected from left ventricle to in one pump, and these are the values to be remembered. Medications are very important. The most important and most scoring part obviously it is drugs, and so let's talk about them. AC inhibitors or ARBs vasodilate to lower blood pressure, only affect BPA and not heart rate. Very important. So its function is to do vasodilation and lower down the BP, but it does not affect heart rate. That is also very important. So AC inhibitors which have the suffix pril, for example lisinopril, the side effects is dry and nagging cough here. Okay. And in ARBs, which is angiotensin 2 receptor blocker, the suffix is sartan. An example is Losartan, and side effect here is it increases potassium level. And use ARB if ACE is not tolerated. ARB only used if it can't tolerate AC inhibitors. Second comes beta blocker, and the function is to lower down the heart workload, decreases the workload of the heart, and the suffix used here is lol. So here example is metoprolol, and always check BP and HR prior to giving. This is what we should do. Then the side effects are mask hypoglycemia, then bronchospasm, and then bradycardia. Then we come to digoxin. Digoxin, it makes the heart pump strong plus slow, like it is known as positive intotrope. Here we check APL pulse before administering. And monitor digoxin toxicity. Hypokalemia increases risk, so on to monitor potassium levels. So low potassium is equals to high toxicity risk is what we can, it can be known by heart fail by digoxin. Then calcium channel blockers, it relaxes vessels to lower blood pressure. And examples here are Vepramil and nifedipine. Do not give if the heart rate is lower than 60 or SBP is lower than 60 or large drop of BP is seen. Then comes vasodilator. They dilate vessels to decrease preload and afterload. Example here is nitroglycerin, hydralazine, and isosorbide. Avoid if sildenafil within 24 hours. Then diuretics. Remove excess fluid from the body. Potassium wasting used in worsening or acute heart failure. And example is furosemide or torsemide. Always check BP before giving diuretics. And here it is potassium sparing spironolactone. Spironolactone is basically potassium saving, and loop diuretics is potassium losing. And normal K plus level should be 3.5 to 5. So if you remember this, that heart failure means it leads to lower cardiac output, left means lungs, and R means rest of the body, then BNP and EF is the diagnosis, and drugs are used to reduce the workload and remove fluid. We are already ahead of 90% of students, and if this helps you, you are not studying alone anymore. You have got your BPA buddy with you here.